So it was thought up by some of the staff on H Ward who are amazing at thinking up any sort of activity to do with our patients, but it's really important for reminiscence. There was lots of photographs of old Southport and old areas that people would have lived in, and it creates a conversation starter.
Well, we used to come nearly every weekend because my father-in-law lived in Southport.
Yeah.
And we lived in Mago, so we used to come into Southport
Oh,
nearly every weekend. That's lovely.
It was good, and then
It's very much a how can we make this person feel that they are at the centre of all of the things that all these people in these teams are doing for them, and seeing if there's any way we can include families in that as well. So a lot of it is liaising with people and seeing what makes a person feel like themselves.
So the readers are they're a little bit like computers on wheels. They're loaded with lots and lots of different apps to help us to engage with our patients. So there's sing-alongs on it, there's movie nights, there's lots of old films on it that you can use, there's different games, there's lots of old photos. So and it is just to keep people engaged, keep them talking, keep their minds active while they're in hospital.
So music is processed in a part of the brain that dementia doesn't really affect. So using music therapy really can bring a person out of their shell, especially if someone maybe isn't interacting with staff or isn't interacted with family even. It can just reignite a spark that you maybe haven't seen for a little while.
We had some guitarists from the University of the Third Age came in and did some singing on a couple of wards. We had a lovely lady who came up to 14A and did some singing and playing on the piano. And we've had some therapy animals within the trust as well. We've had some dogs. We've even had a Shetland pony in this garden. So, yeah, we've got lots of different projects that we want to crack on with.
Yeah, thanks so
30, line 30.
So only 3 numbers.
Giving someone back a piece of themselves makes them think, well, actually, yes, I can do all this and I'm going to engage with all these services, and it can lead to a quicker discharge as well, which is always what everybody wants.